All right, everyone, thank you so much for coming. We're going to go ahead and get started. Let me share my screen. All right, everyone, thank you all for coming. Welcome to Family Medicine and Preventative Care with Dr. Olevia Metry. Just a few quick notes before we start the presentation. Please hold your questions until the end of the presentation. You can either use the chat box or the Q&A when asking your questions. Captions are provided for this event. You can press the captions button at the bottom of your screen to view the captions, and the link for Spanish captions is in the chat box. A few days after the event, everyone who registered will receive an email with evaluation forms from both the library and from our grant sponsor. Please do consider filling out the evaluation forms because they greatly help us provide and improve our future programming. On behalf of the library director, Cy Rao, and our entire library staff, I would like to start by thanking Hackensack Meridian Palisades Medical Center, Nikki Medeiros, and Dr. Olevia Metry for generously donating their time to organize and appear at this event. We really greatly appreciate you all being here. I would also like to thank the National Network of Libraries of Medicine, Middle Atlantic Region, a partner of the All of Us Research Program, for providing a grant funding tonight's captions. The All of Us Research Program aims to build one of the largest, most diverse collection of data of its kind for health research. The goal is to have 1 million or more diverse volunteers nationwide who will sign up to share information over time. The goal of the program is to help researchers understand more about why people get sick or stay healthy. By looking for patterns, researchers may learn more about what affects people's health. To learn more about the All of Us Research Program, visit www.joinallofus.org/NLM. So without further ado, I'd like to introduce Dr. Olevia Metry, who is a physician at Prompt MD Urgent and Primary Care in Hoboken. Let me just stop sharing my screen. Dr. Metry, it's all yours.
Thank you. All right, so just a quick correction. I'm actually not at Prompt MD anymore, but I am at the Hoboken Family Medicine that is by Hackensack. We are a part of Hackensack, but it's in Hoboken. My name is Dr. Olevia Metry. Thank you guys so much for coming and giving me your time tonight. I know that it's a Wednesday night, so I will try to not be too long here. So tonight I wanted to talk to you about family medicine. I want to discuss what family medicine is and what it can be for you and what it can provide for you. And I can't talk about family medicine without speaking about preventative care. All right, let's get started. So as through the introduction, I was working at Prompt MD, which is an urgent care. And before that, I was working at another urgent care. I spent 3 years working at urgent cares. And this is kind of why I went right back into family medicine and family practice. Everyone would come in and they would have high blood pressure, high cholesterol. Yes, of course, I would see some patients who had a laceration that needed suturing, maybe a fall that needed an x-ray, etc. But so many of my patients would come in for blood pressure medicine refill. And I would, of course, the family medicine doctor in me would come out and say, do you have a primary care doctor? Of course, I'm happy to see you, but you should really see a family medicine doctor. And they would say, well, I'm just pretty healthy, but I don't have like a regular doctor. I kind of just come here whenever I need a refill or feel sick. Well, let me tell you about some silent diseases that you might know about. So just because you feel and look healthy does not mean that you shouldn't see your doctor. Diabetes, for example, most of my patients don't have any symptom at all. I actually just diagnosed one today with prediabetes. She is 130 pounds, young in her 30s, and she was shocked, and so was her family. I was following up with her for her blood work, and her hemoglobin A1C, which is a marker for diabetes, was high, and it categorized her in prediabetes. And she was shocked. So a lot of these diseases don't really show up with a flag like, hey, by the way, you're sick, you should go see a doctor. Other diseases like that are high blood pressure, thyroid disease, heart disease, cancer, osteoporosis, liver disease, mental health issues. Sometimes I have to really pull it out of a patient and then they leave like, oh, I guess I do have a problem. And addiction. After 2020, I have diagnosed so many people with problems with addiction, specifically alcohol. A lot of people, it's a slippery slope and they drink maybe daily. And I always have to kind of pry and say, okay, so how big is this cup? What are we talking about here? Small, big, what are we drinking exactly? And after I do the math, I'm like, this is actually a problem. This is no longer social drinking. This is alcoholism. So a lot of these things, your doctor has to be the one to kind of tell you have it. So who of all of these people should see a family doctor? A 20-year-old female with a UTI or urinary tract infection, a 55-year-old male with headaches, a 63-year-old male with constipation, a 32-year-old female needing contraception, a 40-year-old female with dizziness, a 48-year-old male with heartburn, a 50-year-old female who felt a breast mass, or a male or female that are seemingly healthy? The answer, of course, is all of the above. So, how do we practice good medicine in the 21st century kind of world? Everyone is so used to fast food, Uber Eats, Uber and Lyft. Look at this. This is like a CVS medication vending machine that's at a subway station. And there's even a farmer's market located in some subways now with fresh produce. And of course, Amazon Prime. Everyone just doesn't have the time to go to the doctor, they say. Well, my answer to that is, on average, Americans aged 18 and older spend more than 4 hours a day watching TV. 4 hours a day. On average, users spent 2 hours and 24 minutes per day on social media in 2020. So when I read that, I was like, okay, 2020 was really bad. I spent a lot of time on social media too. Maybe it was just a bad year. I looked at the 2019 stats and it was 2 hours and 22 minutes. So it was only 2 minutes worse. And on average, your family doctor may require an hour of your time once a year. One of my favorite quotes of all times is, if you don't take time for your wellness, you'll be forced to take time for your illness. And you have to excuse me, I do have allergies, so 1 second. Okay. All right. I can't get in to see a doctor for months when I need one. That's the classic line I heard in the urgent care facilities. I called my doctor and I was sick and he couldn't see me for 2 months. Well, first of all, most doctors have daily protected time slots for same-day visits. It doesn't hurt to ask, so I would definitely check first. But if you're constantly calling your doctor and he's just unavailable, he or she, always unavailable or can't see you for months at a time, maybe it's time to find a new doctor. And my third and best tip for this is to always plan ahead. I have some patients who designate a specific month of the year for health maintenance, like their physical, their mammo, their dental appointment. And I love this idea and I've been recommending it to all my patients. I would definitely not pick the end of the year in case your doctor wants to send you for some imaging or some workup or something, and you just don't want it to be around the holidays when you're already so busy. So let's talk about the power of prevention. There's 5 things that I'm going to talk to you about today that your family doctor is going to help prevent disease with. First off, infectious disease. We can't talk about prevention without talking about infections. So first of all, your family doctor will always screen you for certain infections depending on your risk, age, and symptoms. And of course, vaccines. So I have a kiddo that is now 19 months. We've had to take him into the doctor for preventative visits for vaccines at least 7 times. I counted before this presentation. And so people think that after your pediatrician is done with you, you don't need to go see your doctor for preventative visits anymore. But that's just not true. You still need your flu shot every year. The zoster vaccine, or the shingles vaccine, you can get it after 65. 50, I'm sorry. The pneumonia vaccine or pneumococcal vaccine, you can get it after 65, depending on your risk factor. Sometimes you can get it earlier if you're like diabetic and stuff. The Tdap, which includes the tetanus shot and pertussis, which is an important infection to be protected against if you're around babies, which is the known whooping cough, that you're supposed to get every 10 years. The HPV vaccine, which is one of my favorite vaccines to talk about, is against the HPV virus or human papillomavirus. And the human papillomavirus is the main cause of cervical cancers. It causes more than 90% of all cervical cancers. So whenever someone says, well, they haven't come up with vaccines against cancers yet, I always say, yes, they have. And of course, pre-travel vaccines. So a lot of patients don't know that you still have to get these. So if you're going to like Thailand or Africa or something, you still need to get like Hep A vaccine and things like that. Okay, power of prevention. Next up is cancer screening. Your family doctor is going to be your favorite person. Not really, everyone hates these, but these are really important. We always send you for cancer screenings depending on your age and of course your symptoms. So we always ask very important questions to make sure that we don't need to send you for early screening of specific cancers. But we always also check your skin for cancers or ask you, is there any rash that's popping up or changing in size, color, etc. that you need to show me? And I always ask that question every physical. Colon cancer screening, although it has been changing around a little bit, but you should get it screened at 50, or it's just once a year for, once every 10 years. Lung cancer screening, you have to really qualify for that one. It depends on your smoking history, secondhand smoking history, etc. Cervical cancer screening. So about this one, it really depends on your primary care doctor. They should be either family medicine or internal medicine. If they're family medicine like myself, we are actually trained in doing our own pap smears. I do my own pap smears in my office. So cervical cancer screening, I do it myself. But if your primary care doctor is an internal medicine doctor, they can just send you to your GYN. And breast cancer screening, which happens after 40, and that one is annually, every year. And we just can send you to your mammogram without needing to send you to your OB or anything. Okay, next up. Oh, there's one more thing I wanted to say about screening, cancer screening. So a lot of patients have, of course, the power of Google. And so a lot of patients will come and tell me, oh, I know I'm not ready for the colon cancer screening. That's at 50. Well, it really depends. I always ask my patients about their family history. If you have a family member, like let's say a father or a mother who had colon cancer at 50, you're actually supposed to be screened at 40. And if you have specific like symptoms that raise a flag for colon cancer, then I will also send you for screening earlier. So it's not really black and white when it comes to cancer screening. Okay, next up, chronic disease. So chronic disease is defined as a disease that lasts over a year and it requires medical attention that is kind of regular. 6 in 10 adults in America have a chronic disease. 4 in 10 have 2 or more. Chronic diseases are things like diabetes, cancer, heart disease. They're the leading causes of death and disability in the United States. Risk factors of the most common chronic diseases could be manageable if detected by your family doctor. So a lot of times you'll come into the doctor, and I have some patients who kind of argue everything that we do. They're like, do you have to take my blood pressure every time I'm in here? Yes, we do. It's screening you for other things. I'm screening you for high blood pressure. I'm screening you for heart disease. And so things that we screen every single time that you're there for your physical. I screen you for high blood pressure, like I said, high cholesterol. I always ask about smoking. I always ask about diet. I ask nowadays, of course, I have to ask the question, are you working from home? Because I'm trying to see if you're living a sedentary lifestyle. And if you are working from home, I always talk about, okay, so are you getting activity elsewhere now that you're sitting at your desk mostly? I always ask about alcohol intake and, of course, drugs, etc. And these are all screened annually during your physical. So, what are some ways that your family doctor can screen and prevent these chronic diseases? Like I said, vital signs, history, and physical. I really get personal with my patients. I try to make them feel really comfortable. And this is kind of why you have to, or you should, keep your family doctor the same doctor for as long as you can. Because as much as I get to know you, then I can kind of compare your results this year to last year, your answers this year to last year. And then once you tell me something specific about your history, like what I mentioned earlier, a parent having cancer at a certain age, I actually input that into my computer and I can read that the next time and kind of bring it up if you forget. I always counsel my patients on smoking cessation and alcohol reduction. And of course, we always do blood work. And again, this is one of the things that some of my patients will argue. Do I always have to do blood work? Or if they want a refill on their blood pressure medicine or cholesterol medicine, and they haven't been in to see me for like 2 years, or seen anyone in the practice, they just call and say, can you just refill it? I'm like, no, we need to see you. So we need to see you because we need to also do blood work on you. Things can change. So if I gave you a medicine for diabetes, maybe it has improved, maybe it has worsened. We always test your diabetic numbers. We look for liver disease through your liver enzymes, kidney disease, thyroid disease. We look for blood disorders like anemias, etc. And we look for your cholesterol and how that is going, improving or worsening. Again, this is all done every single year. Okay, the power of prevention. The next part is mental health. 1 in 5 Americans will experience a mental health illness in a given year. Your family doctor can diagnose, prescribe medication that help with your symptom, or refer you to a mental health specialist. Oftentimes, even in the urgent cares, and even today in my own practice, once mental health comes up, they'll say things like, oh, I can't get to see my therapist right now. I can't afford a therapist right now. Or I used to go see the psychiatrist, but I can't see him right now, or whatever it is. Well, that's kind of why it's really important to know what a family doctor is capable of doing. We are very well trained in diagnosing and prescribing medications for most mental health illnesses. Of course, if something is out of my hand, I never, feel afraid of sending out to a mental health specialist. Many patients suffer in silence due to stigma behind mental illnesses. And this is, again, why I really try to make a patient feel comfortable and wish that he would come back to me every single year. That way we develop a relationship and they aren't afraid of telling me something. And I definitely have specific questions that I always ask and try to pry on how they're doing with their mental health. Your family doctor can sometimes pick up on some signs and symptoms. There's something called the PHQ-9 that we do every year, and it's kind of like a questionnaire. So a lot of people don't really know what depression looks like. They think that it's just like, oh, I'm not sad, I'm okay, whatever. But the PHQ-9 is a tool that we use, and it kind of screens you for depression. So things like sleep, how are you sleeping more or less? Are you eating more or less? Are you do you feel like your stress is manageable, etc. And so these questionnaires that we do and probably hand you at your start of your visit may seem annoying and may seem like, oh, this is so much paperwork, but they're all for a reason. And I always ask about my patient's support system. some patients probably find it weird, but I always ask, so do you live alone? Who do you live with? Are you working from home? Who are your friends? What do you do for fun? So don't be alarmed when your family doctor is asking you those questions. I promise we have a reason for it. Many of my patients don't know the wide variety of resources that we have to offer when it comes to their mental health symptoms. So sometimes patients don't know where to go for therapy, don't know where to go for group meetings or group visits, and don't know where to go for any of these support systems that we have in place for mental health. And lastly, on the power of prevention, lifestyle medicine. Almost all clinical practice guidelines for the top chronic disease support lifestyle medicine as the first line of treatment. What does that mean? So a lot of people in the wellness world always say that Western medicine just wants to give you pills. That's absolutely not true. We prioritize lifestyle medicine as the first line of treatment with every disease. I mean, of course, if there's like a tumor, we have to go get it. But even after removing the tumor, we always tell our patients that it's really important to stay active and eat well, etc. As a matter of fact, if I open any of my medical books for you and read, what it says as first line treatment for high blood pressure or diabetes, etc., it's always diet and exercise, stress management, etc. The patient that I saw today that was diagnosed with prediabetes, I didn't put her on any medications. We discussed lifestyle changes. She's young and healthy, and I feel like she can actually totally turn this around without medication. So your family doctor may ask you about your activity level, diet, hobbies, stress management, and weight changes in the last couple of years. 80% or more of all healthcare spending in the US is tied to the treatment of conditions rooted in poor lifestyle choices. And your family doctor can help you decipher the latest fads and trends in the wellness world. So a lot of my patients are currently on keto diet. I have a lot to say about that, but it's probably for another lecture. But it's not that I'm against it, but it can absolutely do some other kind of damage if you're putting like butter in your coffee and just eating bacon all day. There might be a healthier way to do keto. So I always talk to my patients about their diet. I always say, so are you doing like keto, paleo, vegetarian, vegan? What's your diet like? And once they talk to me about it and I see that they're willing to kind of listen, then we can kind of discuss that. Okay, so I'm hoping that everyone here is convinced that you need to see your doctor. So next up, how do I find a good doctor? So first of all, you already pay for your insurance. So I would personally find someone in my network. That's how I found my son's pediatrician. That's how I found my husband's like sinus surgery guy in the city. So we just kind of looked through our network's website and we looked at some of the doctors. And well, we kind of looked them up, but that's coming up next. So your primary care physician should be trained in either family medicine or internal medicine. That is really what a primary care physician should be. And if you don't know the difference, I'll just quickly explain. It's not better or worse whatsoever. Family medicine is trained in pediatrics and in women's health. And so if you are a female who wants to see just one doctor, isn't planning on getting pregnant and just kind of wants her contraceptives, maybe deal with a UTI, etc., I would maybe recommend a family medicine doctor. If you are a person who has like kidney disease, etc., maybe an internal medicine might be a little bit better at that because they trained much more in the hospital. So they dealt with like a lot of kidney failures, a lot more than we did, etc. Is your doctor board certified in their specialty? Again, I just really like to inform patients what that is, and I'm not saying anything is better or worse. So a lot of doctors can actually practice without renewing their board certification or taking their board certification exam. And so I often, whenever I'm looking for a family member to find their doctor, etc., I always make sure that they are board certified. What does that mean? So board certified in that specialty means that after medical school, you go to residency to do that, whatever residency in whatever specialty that you choose. So I did mine in family medicine. I trained for 3 years in just family medicine. And after those 3 years were done, I took a board certification exam in family medicine. A lot of doctors forego that test and they just practice with board eligible. The problem with that is a lot of this test requires you to read up on the latest treatment, latest testing, and just keeping up to date. And so I have to constantly do a lot of continued medical education to keep my board certification status and take more and more tests as I go, just to keep that 2 words underneath my name, board certified. And so to me, I think that I would want to require that of my doctor, but you make your choice. My next opinion is, or advice is, look up your doctor. So I always kind of Google the doctor that I'm going to or my family's going to. And I think of it kind of like Yelp whenever I'm going to a restaurant. Of course, be very open-minded. There's always going to be the angry customer who had a bad day. So look up your doctor with the same mentality, just knowing that that patient probably showed up on the bad day or on the wrong day, had to wait a bit longer or was stuck in traffic. And so things happen. But if there's a trend, if the patients are all saying had to wait 2 hours in the waiting room, my doctor was very dismissive. My doctor didn't listen to me. I had to wait 2 hours for a 5-minute appointment with my doctor, etc. Then I would personally kind of try and find something else. I find so many patients saying, well, I have a doctor, but I'm not a fan because X, Y, Z. I'm like, well, you can find another doctor. And my next advice is ask around. Chances are a coworker, a family member, or a friend already knows a really good doctor, and you might just be able to go to the same one. And again, if you don't like your doctor, don't be discouraged. I hear so many patients saying the words, I hate doctors these days. I used to know that dentists would hear that from every patient. As soon as you sit in the dentist's chair, you always look up and say, I'm so sorry, but I don't like dentists. But I've been hearing that a lot too. I'm so sorry, but I don't like doctors. Don't be discouraged. You just need to find the right one. And that is it. This is my little kiddo who is hopefully playing doctor one day. So thank you so much for the time, and I will gladly take some questions if you have some.
If anyone has any questions that they want to ask Dr. Metry, you can either put them in the chat box or you can put them in the Q&A box. Now there is one question already in the Q&A box, so I'll read that out loud to you. What's the difference between a family doctor and a primary doctor?
Okay, that's a great question. So a primary care doctor can be a family doctor. A primary care doctor can be internal medicine doctor. A primary care doctor can actually also be a pediatrician if you are 18 or younger. I think that's it. Yeah. Some people use their OBGYN as their primary doctor. I hear that all the time, especially around here. It's kind of new to me. That's just not okay because your OBGYN is not going to test you for your cholesterol. They don't care about your cholesterol. I highly, highly love and respect all my OBGYN doctor friends, but they're not going to check for those things. And so there are going to be things that are going to be missed.
All right, we have another question. How do I find out if my doctor is board certified?
Good question. So I actually, before this presentation, was thinking of that, and I was trying to find online if you could see that I was, and I couldn't find that on our website, on our Hackensack website. And I don't know if it's like, you'll be too far in to like ask the doctor if I told you to just ask them. I'm honestly not sure. I think one time my friend found a website that can fact check that. I don't know it personally. I'm so sorry.
If anyone has any other questions, please feel free to put them in the chat or the Q&A box. Here's a question. When do I know when I need to go to either a PCP or a specialist versus a specialist, I'm assuming?
So traditionally, you would go to your PCP first to ask about that concern. And they would then kind of decipher whether it's time for a specialist or let's try this or let's try that. Even for skin things, a lot of people see a rash and they're like, I need to see a dermatologist. Well, your primary care doctor is very well trained in a lot of skin things. So I remember seeing because before you go see a patient, the medical assistant will write a little note. And the little note said, patient is here for a dermatology referral. So I was like, okay, maybe. So I go in and I introduce myself and we go on and she's like, oh, I need to see a dermatologist and I need a referral. And then she showed me her rash and it was just ringworm and I treated it and she didn't need to go to a dermatologist. So in my opinion, you should go see your family doctor. They could probably deal with the problem. Or they can then refer you to your specialist.
This next question looks like it's a follow-up question from the previous question about board certification. Why not just call the doctor and ask if he or she are board certified?
Yeah, I think that's a good one. I think maybe ask the office. I know that on big institutional websites, I have seen it previously. Like I said, my husband recently needed sinus surgery. This is probably HIPAA. Sorry, husband, but I saw on the website. So you know what? It was actually on our insurance website. So on our Blue Cross Blue Shield insurance, it actually said board certified and some people it said board eligible. So for her, it was board certified in XYZ. So maybe your insurance website where the network will show you who is in your network, it might have it on there. But I know also big institutions for example, academic institutions will have it in the description of the doctor.
Okay, another question. How do I find a reliable doctor without insurance?
Oh man, without insurance. Honestly, I don't know. Maybe you guys can help with that one.
Nikki, do you have any insight? Nikki, you're muted.
Here we go. Okay, finally my speaker is now working. Usually what happens is when we do a lot of health fairs out in the community, we have a lot of patients that come to us and have no insurance. What we do is we actually refer them to a federally qualified agency. In our area, it's the North Hudson Community Action Corp. And they have various locations all over the state of New Jersey, especially in West New York and in Union City. They're very good. They have specialists all over. And they have, of course, primary care and family medicine, but they will take your income or non-income and consider it when they are actually taking care of you. And nobody's denied. So definitely a North Hudson Community Action Corp. Anywhere that's here, it's the best place to go. That's how we refer our patients.
That's amazing. I do have a follow-up answer. Doximity.com is where you can see that information. I'm going to put it in the chat. I just remembered the website, doximity.com.
Perfect. That actually, I think, went to the panelists rather than the attendees.
Oh,
sorry.
I'll copy and paste. There we go.
Perfect. Thank you. I do have another question in the chat. I heard there was some controversy regarding the HPV vaccine. Can you briefly discuss what that controversy was about?
Yes. So I think there was some propaganda about HPV vaccine causing, I believe, infertility, but it was debunked many, many times. And there was there's been multiple statements by the CDC saying that there is no fact behind that. If it helps, I am HPV vaccinated and I have a child. So it did not cause that for me. There's a lot of, anti-vaxxer type of misinformation out there. And just know that we test vaccines so much on so many people, and they would never be given if they really caused something bad and big like infertility.
All right, if there's any other questions, please feel free to put them into the chat or the Q&A. All right, it looks like we're done with the questions for this evening. So thank you everyone so much for coming out tonight. We really appreciate you being here. And a big thank you again to Hackensack Meridian Palisades Medical Center, to Nikki Medeiros for setting this up, and to Dr. Metry for generously donating her time to come on tonight.
Thank you guys so much. This was so fun. Thank you for being here.
All right, have a very good evening, everyone.
Thank you all for coming.
Bye.
Bye.